I started this about 10 years ago, and specifically for drug discovery, you have to go in your research the extra mile to show how safe and effective the drug is.
Dr. Perez spent her career working in an area of neurotransmitters, neurotransmission, and specifically in degenerative diseases like Alzheimer's disease. And they're really important in maintaining blood pressure, but also effects in memory and learning and cognitive signaling.
We found that a particular subtype of the receptor, called the alpha-1A, was cardioprotective. So it can reverse heart failure. And then we made this other mouse model where we took a green fluorescent protein and tagged it to the receptor. And when we looked in the brain, we saw all of these cognitive centers light up. And at that point, that was our first notion that if we could activate this receptor selectively, that we had a drug for Alzheimer's disease.
And that's really the heart of her work, is that she had proposed this hypothesis where we could modulate these receptors through classical signaling, but through what we call allosteric signaling, which is really a way to modulate the receptor and fine-tune it.
We made the drug and we studied its pharmacology and its properties, but when we actually put it into a mouse model of Alzheimer's disease, we saw essentially a complete reversal of the disease. And it reduced the beta-amyloid proteins back to almost normal levels, and there was no blood pressure effect. And so we were just like, wow, the potentials, for this drug could be great. We've shown our drug can increase neurogenesis. So this is the production of new neurons. So it's not just protecting the neurons that have survived the degeneration that's already occurring, but it be able to regenerate new neurons to take their place.
These adrenergic receptors have never been targeted in this way before. So this is a first-in-class approach. If the molecule shows safety profile, it'll then go forward into additional studies and ultimately into human subjects and healthy volunteers. It is opening many doors on the molecular level, but also on the pathology and the progression of the disease.